The New Mexico Momcast is a show from ABQ Mom for local moms as we navigate raising our kids in the land of enchantment. We'd like to thank Lovelace Medical Center for supporting today's episode. When we think of February, it's easy to picture candy hearts, boxes of decadent chocolates, glasses of red wine, and bouquets of roses for Valentine's Day. But February is much more than that. It's American Heart Month. Did you know that heart disease is a killer that affects more women than men? It's true, and it's also true that heart disease, when discovered early, is potentially reversible. That's why Heart Hospital of New Mexico at Lovelace Medical Center offers a fast, easy, and affordable $150 heart screening that saves lives. How do you keep your heart healthy and happy? A simple heart screening can help you get your heart healthy. Show your heart some love and call 505-835-1615 to schedule your heart a scan today. Welcome
to the New Mexico Momcast. I'm Vanessa Bush.
And I'm Becca Lesko-Toops. Hi, Vanessa.
Hi, how are you today?
Pretty good. Freezing, but good.
Such is this time of year, right?
Yeah. During December, I was just telling myself, I was like, don't get used to this. It's going to get really nasty cold in January and February. And here we are.
We really had such a mild December. I was not sad. At all.
No, I just want snow. I'm not like, as soon as the Christmas lights are down, I'm done. I just want warm. Yeah. You're a Florida girl, but you look real cute in a sweater. So.
Oh, thanks. Yes, you can take the girl out of Florida, but she still wears flip-flops all year long. I'm like, oh, do I have to leave the house and put on like socks?
Proper shoes. Yeah. Flip-flops. So you call them flip-flops though. I grew up calling them thongs, and then that got eliminated. People looked at me real weird after a certain point.
Yeah, did not say that the thong is something else.
Yeah. Well, we quickly changing the subject before this podcast spirals. We are talking about heart health today, and I think it's wonderful as we are beginning the month of February to discuss this as women who, as we talk about all the time, kind of let our health go by the wayside kind of for our families in a lot of instances.
Yeah, that can happen. I know I have fallen prey to that for sure in the past, and trying to book all my doctor's appointments and make everything happen so I can keep up on it. But yeah, I think this is such an important conversation to have.
Well, you interview Kate from Lovelace, who is a nurse at the Heart Hospital. And I listened to this interview and I was like, wow, I'm in my 40s. So I'm like, I'm not going to have a heart attack. I'm fine. But then hearing that this is the number one killer for women was really a wake up call. And then kind of talking through like I'm healthy, I'm active, but my dad had a heart attack. And so maybe I need to get checked and screened and have that kind of prevention. So, so that your children aren't going through those kinds of things, and that kind of fear.
For sure. I think I have some family history as well. So I know that I definitely need to do all the things and make the appointments. But yeah, Kate is really impressive and so knowledgeable. She's the director of Cath Lab, Electrophysiology Lab, and Pre-Op PACU at the Heart Hospital of New Mexico at Lovelace Medical Center. So she knows her stuff.
Yeah. She's been around the heart a while. She knows what she's talking about. I hope all of our moms out there will listen into this and kind of take that seriously and take the steps to get pre-screened, because I'd rather be pre-screened than end up in the back of an ambulance.
Yeah, and I'm glad I got this interview because it's a topic that's near and dear to my heart. We had a heart episode in my family just last year. My husband had a torn heart valve and had to have open heart surgery, and he was only 47. It wasn't on my radar that we would have to be dealing with heart things in our 40s at all. And his wasn't necessarily caused by lifestyle. It was just kind of like one of those things. But still, I know more about the heart than I ever cared to know. I was like, I'd be good about this. And it was very important for him to be like informed. He wanted to know exactly what would happen to him. So he's like watching videos of surgeries and he's like, I can't believe you don't want to watch with me. I'm like, That is actually the last thing I want to do is watch a heart surgery.
I don't want to see the insides of anyone, to be
No,
honest.
no,
My
no.
husband does that for a living, and I'm 100% not interested at all in seeing the inside of a surgery ever.
I'm going to say hard pass to that.
Yeah.
One of the things that I was a little bit surprised about, though, during the interview, I wouldn't say surprised, but just like it's not something that's part of my everyday thinking, is how stress can be so bad for your heart. I mean, like, duh, like people on TV get stressed out and have heart attacks. We've all seen those movies or whatever, but I guess I just hadn't really put it through the filters for me. So do you have like a specific way that you manage stress?
That's an excellent question, Vanessa. First of all,
Not a lot.
yeah, I don't have stress in my life. What are you talking about? I think everyone listening and myself and you, Vanessa, let's all just take a deep breath right now.
I could use that. That wasn't even as deep as I needed it to
Yeah,
be.
it probably needs to be a little deeper. And I think that's a good reminder to stop and breathe. Exercise is definitely a big de-stressor for me. And I've been doing a lot of yoga, which incorporates breath, because I find when I'm tense and stressed, I'm always holding my breath. And that's a no good, because our body and our hearts need oxygen, right? I think.
Important stuff.
That's how it works. What about you? How do you de-stress?
Yeah. So I have had seasons of my life where I was really into yoga, and I'm not in one of those seasons right now, and I miss it for sure. So, yeah, but I think a lot of like talking and just making sure I'm not like holding stuff in is really important for me. I am a verbal processor, so I gotta have it out there in the open. Thank you, all of you Albuquerque moms, for letting me process live right now.
Thank you for giving Vanessa this platform so she can just not hold on to any of her stress and just let it all go. Let it all go. Well, I'm excited for our listeners to hear this interview you had.
Yep, let's go listen in. Well, hi, Albuquerque moms. I have Kate Muller with me today. Kate, thank you so much for being here. So, Kate, February is American Heart Month, and just a time to raise awareness around cardiovascular health. Why is this even so important? Like, why have an awareness month about this topic?
We use February as a awareness month for heart disease because it's a very important thing to make sure that people are aware of. Heart disease is the number one leading cause of death for women in the United States, and it can affect women at any age. Heart disease is a lifelong condition, and it cannot be cured, but it can be managed. So helping people understand what heart disease is and how that is managed helps people have longer, more healthy lives.
So important. And I think, it's February. We're already wearing our heart t-shirts and buying heart candy. So let's think about our actual hearts. That makes sense. Good job, powers that be who are deciding awareness months. So what exactly is heart disease? I mean, I hear that word all the time. I know maybe it causes heart attacks, but what exactly is it?
So heart disease is a general term that is used to describe a variety of conditions that affect the heart and the blood vessels. One of the most common forms of heart disease is coronary artery disease. And that's when a blood vessel that supplies your heart muscle becomes damaged by cholesterol, calcium, plaque buildup that prevents the flow of blood from getting to the healthy tissue. So that is what actually causes a heart attack. Other forms of heart disease include congenital heart disease, valve disorders, and rhythm disorders. Those are the most common types of heart disease.
Okay. So that coronary artery disease you mentioned as the most common, maybe what are some of the signs and symptoms of coronary artery disease?
Yeah, no, that's a great question. This is also something, that we discuss very frequently when speaking of women's health, because the signs and symptoms can vary greatly between men and women. Oftentimes we expect people that are having a heart attack to have those symptoms that we always see on TV where someone grabs their chest and falls to the ground or has arm pain or jaw pain. And while those are very, very common symptoms, women often have a lot different presentation. They can even not have chest pain at all, but women often have shortness of breath. They have pain that radiates into their stomach or up into their upper back. They also do sometimes have neck pain and things like that associated with it. Some people even have nausea and vomiting as signs and symptoms of heart attack. So it's important to know that it doesn't always look like it does on TV, but whenever anyone's experiencing something that is a sudden change, that's always something that we want to investigate.
That's a great tip. Like if it's a sudden change, totally abnormal from just like your status quo, that's a great tip. Absolutely. What would be some risk factors that might be present for coronary artery disease or heart disease in general?
Risk factors for heart disease in general include smoking, high blood pressure, cholesterol, being overweight, having an unhealthy diet, being physically inactive, and also stress. Stress contributes significantly to our overall heart health.
Okay. That's important. I'm like, okay, stress. Don't be stressed. No, don't be stressed. That's all I can think about.
It's a hard thing to avoid in our lives. But I think, learning the signs and symptoms of, when you are experiencing a significant amount of stress, finding healthy coping mechanisms and ways to manage that stress is very, very important, especially as women. We are so basically keyed to take care of others. We're taking care of our loved ones. We're taking care of our children. We're taking care of our family members and our friends and our extended work families. And very often we don't take care of ourselves the way that we take care of other people.
For sure.
So I think that's also very important to discuss when we're talking about women's heart health. You have to take care of yourself to be able to take care of others, as I tell my nurses.
So good. And I always think when it comes to things like that, it's like I have to manage the stress, or stress is going to manage me.
Absolutely.
So let's make sure that I'm the one in charge, not it, right? So what are some ways? Obviously, managing stress in a healthy way, but other ways that we might be able to reduce our risk for heart disease. What would those be?
There's a number of things that you can do to make sure that you are having a healthy lifestyle and that you're making good, healthy habits. There's a number of things that we can all incorporate into our lives. Things like making healthy food choices, limiting alcohol intake, prioritizing movement, aiming for 30 minutes of physical activity per day. Again, managing those stress levels and making sure that we're aware of our body's response to it. I know everybody knows smoking is bad for you, but quitting smoking can greatly decrease your risks of having heart disease in the future. Staying up to date on your health screenings, checking your blood pressure regularly, all of those things can definitely contribute and help people identify issues when they're early so that they can be managed before it's a significant disease.
That's great. So just being proactive.
Absolutely.
I love that. Yeah. So obviously our audience are moms, and a lot of brand new moms or even moms who are pregnant. So what about heart health while someone's pregnant? Because of course a pregnancy just affects every piece of your body. And how might heart health affect the baby? What can you tell us about that?
So there's a number of things that can happen when we're pregnant. Obviously, your body's changing in multiple ways, physically and hormonally. But having healthy cardiovascular practices during pregnancy can really lead to better health and outcomes for both the mother and for the child. Having, standardized screenings so that we can identify people that are at risk for having blood pressure issues or diabetes issues during their pregnancy is very, very important. Often this is the first time that women experience these types of symptoms. People that have normal blood pressures, people that do not have diabetes often have things like preeclampsia, that is an elevated blood pressure during pregnancy that can cause a lot of damage to both the mother and the baby. But also gestational diabetes is a real risk. I've read recently that it really kind of gives you a sneak peek into things that could be going on in your body that you didn't even realize. For young women with no apparent signs of heart disease, pregnancy is kind of a unique and natural time to unmask hidden risks for heart disease. And sometimes those do come up during pregnancy.
So is it true that pregnant women can be more at risk for heart-related issues than someone
Absolutely.
who's not related or pregnant?
Absolutely.
Okay.
It's one of those things, during pregnancy, everything's changing. Like we said, your weight changes, your blood pressure changes, your glucose levels can change. And so the combined cardiometabolic stress that people experience during pregnancy can really help guide interventions and reduce risk for later in life. So sometimes having complications like preeclampsia and things like that, like gestational diabetes, those can be very scary times for mothers, but it's also an
Yeah.
opportunity to learn about how your body is functioning as a whole. When it's under additional stress from the pregnancy, a lot of those things are unmasked.
I think this just goes to show how important those prenatal visits are, because I know you're getting your blood pressure checked all the time, and your doctor, your OB is screening for these things. So important. Yeah.
And overall, about 10 to 20% of women have some sort of issue during pregnancy that can be
Okay.
attributed to the cardiovascular system. The vast majority of that is high blood pressure and issues with blood pressure. But when you have those, again, that means that you are predisposed to having issues with your blood pressure later in life, even after the pregnancy. So it is
Okay.
important to manage those things and monitor those things really, really closely. Because even preeclampsia during pregnancy can be associated with a 75% higher risk of having complications cardiovascularly later in your life.
That's so important. Okay. Because some of us, me, are done with the pregnancies, but yeah, just knowing that things during my pregnancies might be indicators of what's to come. I think
Absolutely.
that's a really important thing to keep in mind, and just keep myself under medical care, right? And
Definitely making
being
sure we're
preventative.
taking care of ourselves. But I don't think before I worked in cardiovascular health that I was aware that was something that didn't just exist during pregnancy. To know that because you had some of these things happen, it just means you need to be that much more careful as you go through life to make sure that you do what you can to minimize the risks in the future. But the good news is much of this can be prevented. There are a number of things that we can do. First of all, like you said, making sure you're talking to your OBGYN, making sure that you're letting them know if you have a family history of cardiovascular disease, if you have a family history of diabetes. And that way, those are things that they're going to watch a little more closely for during your pregnancy to make sure that you and your baby stay healthy. So it's very
So
important.
important.
Yeah.
So, Kate, just you as a person, how do you personally incorporate heart health into your daily life? I know you're a real busy healthcare provider, but I assume you fit it in.
Yeah, you kind of have to. There's an old saying that you either make time for your health or you make time for your illness, and I think that that's very important to keep in mind. We have a certain number of days on this earth, and how we spend that time is very important, and it leads to the overall quality of your life. So personally, I think that staying active is incredibly important. I try to make sure that I'm getting enough physical activity, even something as simple as going out for a walk after dinner and walking around the block 3 or 4 times and getting your heart rate up a little bit. It helps your metabolism. It helps your mental clarity. There's so many things that we get from exercise other than just the physical benefits. So I think that that's very important. I actually am a person that has diabetes. I was diagnosed with diabetes at a very young age. So it's very important for me to make sure that I'm doing the best I can to manage that disease. I have a continuous glucose monitor that I wear all of the time, so I always know exactly what's going on and closely monitoring that. But making sure that you're doing the best you can to manage whatever issues you have going on. I think that's very, very important. And again, managing stress. I think that for myself, especially knowing my triggers, knowing my warning signs, when I can. A lot of times we're so busy in our lives doing all of the things that we have to do, we don't even realize how much it's affecting us until it's too late. And so I think knowing your own tells as far as when you're getting stressed out and when you need to take a step back, when you need to practice more self-care is very, very important, because very often we're way past that by the time we even really figure out what's going on.
Exactly. Right. Sometimes once the stress symptoms appear, it's like, oh, we should have done something maybe months ago. Yeah.
That's the way
Maybe
it
I should
is.
have
We're
taken a
always so
break like
busy
6
taking
months
care of the
back.
people. Yeah.
Exactly. So tell me about preventative screenings we can do to maybe check on how our hearts are doing.
We're very fortunate to live in the era that we live in. Technology has just improved vastly in the last 10, 15 years. And there's a number of tests that they can do that are very, very non-invasive tests that are very simple to check and actually see how healthy your heart is. There's something that we recommend that people do called a heart screening, which is basically a specialized CT scan that looks at calcium buildup in your arteries, which can be an indicator of coronary artery disease. So these are things that are done very frequently. It's about a 15-minute scan. It's really easy. You're in that CT machine for just a few minutes, and then you get a lot of information about the functionality of your heart. So it helps us in identifying people that are at risk. It helps us identifying people that are in the early stages of disease so that we can make sure that they're getting the best medical treatment possible. So if you are a male over 40, which I know most of our listeners aren't, or a female over 45 years of age, you are
over 40.
Yeah, there you go. You are at an increased risk for heart disease, and so you should definitely consider getting a heart screening. If you have additional risk factors such as diabetes, a family history of heart disease, if you were a smoker in the past, if you know you have a family history or have high cholesterol, all of those things are very important to make sure that you are getting screened when you're dealing with any of these pre-existing conditions or anything that, predisposes you to having some disease in the future. So to find out sooner is so much better than finding out later. If you can know that you have this disease process going on before you've had a heart attack and before you've damaged your heart muscle, it's obviously going to make sure you have a better outcome longer down the road. So
that's so
yeah.
It feels like magic to me. Like tests like this, I'm like, I can't believe that exists. That's amazing.
It's really amazing. And it's amazing how much information you can get in just a real quick, 10, 15-minute scan. And it really will help your doctor kind of guide your care. So if any of our listeners are interested in getting a heart scan, we do offer them here at Lovelace. A lot of insurance companies are actually covering these now, especially if you have any risk factors. So that's something to check on. But even if you don't have insurance coverage, even if you're paying out of pocket, the cost for a calcium score is $150. So that's usually fairly manageable for most people. And especially when you know that it could help save your life or extend the quality of your life, that's very, very important. So if anyone's interested in scheduling a heart screening with Lovelace, you can call our radiology scheduling desk at 505-835-1615. So please, do everything you can to keep yourself healthy so that you can be there for your friends and your loved ones and your kids and watch them grow old and be there with your grandbabies. So it's very important.
So I'm like really impressed with this heart scan situation. So so it's non-invasive, and during the scan, is it similar to like a CT scan or an X-ray, or what is it? What is it like?
It is actually a CT scan. It's just a specific sort of technology. So unlike MRI, where you're completely closed in, your head will be free and out of the machine. So if you're somebody that worries about claustrophobia and those kinds of things during the screening, it is very open. It's not, you won't be shoved in a small metal tube. So, and like I said, they put you on the table, they slide you into the scanner, take some images of your heart, and you'll be done in 10 to 15 minutes.
That's great. This is so impressive to me. Okay. And then, so we've had a lot of heart talk, but Kate, I would love to just know some things about you. Can you tell us about your family?
Sure. I'm a nurse, obviously. I've been a nurse for about 18 years. I'm currently the director of the cardiac cath lab at the Heart Hospital of New Mexico at Lovelace. I've been honored to work in this heart hospital for 12 years, and I've worked in various positions throughout that time. So it's a wonderful team, and I'm very, very happy with my work family. I really am very proud of the care that we give here and very proud of the work that our physicians and our staff do to help improve people's lives. I come from a medical family. My mom is a nurse and my father is an anesthesiologist, or was. He's now retired. And so I think I've been raised around people that have, higher than normal healthcare IQ. And these are things, that we talked about and I was raised with. But I know a lot of people don't have that kind of access to knowledge when it comes to healthcare. So I've always been very passionate about educating people. It's the reason I became a nurse, is because I wanted to use the knowledge that I had to help people make better decisions and help improve their lives. So I'm very honored to still be able to do that today.
That is so cool. I love that it's like in the family. I love it. Do you have just a favorite place in the Albuquerque area or even in New Mexico that you just love, and maybe it's a little hidden gem that you'd like to share with our listeners?
I love to get outside, and spend time outside and enjoy nature. And I think that we live in one of the most amazing places for that. There's so many things that you can go out and do and so many things that you can see that are just, day trips from here in Albuquerque. So I really encourage people to get out there and go hiking and go find a trail you haven't done yet, find something that you have wanted to see. And there just is an amazing wealth of beauty and nature around us. So
I don't think people realize how lucky we are until you're like in a big city and it's hours and hours and hours to get out into nature, right?
Absolutely. Absolutely.
Do you have like a favorite trail or area where you go with good trails?
I really love, it's funny because it's not at all like a hidden gem, but I really love going down by the bosque, especially this time of year, when there's to just be around all of the big trees and be able to walk around and look for porcupines up in the trees and enjoy all the wildlife that, is staying near the river. I think that it's a beautiful place. We go down to Bosque del Apache a lot as well and go look at birds. And there's a lot of cool hiking trails and stuff down there too. And you usually can catch some amazing wildlife. So
very cool. The trail that's closest to my house that I go on a lot, there's a beaver who lives there and it's huge. It's like 45 pounds.
Yeah, the first time I was down in the bosque and I walked by a tree that had been, obviously assaulted by a beaver, you look at the size of the teeth marks and it's just amazing. They're very large animals. So.
They're huge. I don't know. I just thought beavers were these tiny little woodland creatures. They are not.
No, they're forced to be reckoned with too. They're moving around giant trees out there. Yeah.
Well, I hope everybody will take an opportunity to get outside and get some movement in for your hearts this week. And Kate, I just really appreciate you being with us today and sharing all of this with us. Thank you so much.
I appreciate it. It's been my honor.
Thanks for tuning in to the New Mexico Momcast. Don't forget to subscribe on your favorite podcast platform so you can never miss an episode. If you enjoyed today's conversation, we'd love it if you left us a review. It helps more moms find us. And be sure to follow us on Instagram at NMMomcast and at ABQ Mom _ for more connection, resources, and updates. See you next time.